Hi, I'm Dr. Tal Jergensen of Jergensen Orthodontics, and I would like to talk to you a little bit about the Invisalign treatment that we do in our office. A lot of times patients don't know the process that goes on behind the scenes after they come in for the consultation, and so I'm going to kind of walk you through that today so that you can get an idea of how neat this system of Invisalign is for us as doctors and also for you as a patient. First off, we do a digital scan of your mouth. Many of you may have had impressions done for caps on your teeth. Well, that's the way we used to do things when we did Invisalign, and quite honestly, the trays didn't fit very well. Matter of fact, we had to, on multiple occasions, redo those impressions because there were voids in the impression material or it was distorted, and so that took a lot of time. And those it's also very expensive to do those impressions, but more importantly to you as the patient who is excited to get those Invisalign trays going, you're having to wait and wait and wait. We have many patients get discouraged over that. So we use a digital 3D scanner that takes us approximately anywhere from 6 to 10 minutes to do a scan of your mouth, and it is 99.9% accurate. And what happens is after we do that scan, we send that file over the internet to Invisalign's headquarters in Costa Rica, and that's where they download that file and wait for me to come to them on the internet and give my treatment plan. So I give that treatment plan to them, and then a technician on their end goes in and does what I've requested of him, and then I get back a file like this, and it's called ClinCheck, that I can take it and I can turn it around and I can look at it and see exactly how things are and what we're going to do. And let me explain to you a few of the things that we will see on this ClinCheck. One, we see these tabs here on the teeth. These are called attachments, and they are used to hold aligners in place and, more importantly, to move teeth in a specific direction. These numbers down here, this says 0.4 millimeters. That means that we're going to make that tooth in between the tooth 0.4 millimeters smaller by the end of treatment, and that's how we eliminate crowding in the mouth. We have different views that we have here. This is from the front. This is the upper jaw or the maxilla. This here is the lower jaw or the mandible, and you can see here where the crowding is in this area here. And then we can look at the bite on the right side, and we can also look at the bite on the left side. In this particular place, which happens to be an adult, this patient has all 32 teeth present in the mouth. For us, a lot of times we think, well, just move the teeth back in the mouth so that we can get this crowding unraveled here in the front. Well, the reality is that's a real hard thing to do, and quite honestly, it's heroic. But with Invisalign, we can go ahead and set up a treatment plan to at least demonstrate what that will look like. In this particular case, I've done that. I've done 2 different treatment plans, something that we're allowed to do and comes in very helpful. It's very handy for us to do in demonstrating to patients how we move the teeth. So here is the extraction treatment plan, in which we're taking out this tooth right here such that we can move this tooth back into a proper relationship. And then we come down here, and I have control buttons here that I can move forward one at a time or play in a sequence. And down here, this orange colored number that is going to progress along this bar here tells us what stage we're on, and it also lets us know the total number of trays that are going to be used for this. In this case, it's going to take 49 trays, which are used worn for 2 weeks each, so we're looking at approximately 24 months of treatment to get through this. So now let's see what happens here, and we'll show you how the teeth move. So I push play, and sure enough, that tooth right there was extracted, and now we're moving these teeth here in the back forward, and these teeth here in the front back, and now we've got the teeth where we want it, and now you can see how these teeth move here. So now we can spin it around, and look at that. This is great because many times patients have teeth that are smaller in size. And so when we get done, we can actually plan to have this tooth made bigger. And that's up to the orthodontist to decide if there is a discrepancy in the size, and then work with the general dentist for him to do that which he's really good at, which is cosmetic dentistry. In this particular case, even though this space here looks huge, it's only 1 millimeter wide, and that's going to enable us to have a buildup done on that tooth so that this smile will look much, much better when we're done. So let's go back and show you what we look like to begin with. Take out one tooth up here on the upper right, moving the teeth, correcting or jumping the bite here where we had a cross bite, and then extruding or bringing that tooth down, and that's why that pink attachment was placed there, such that we can get that. And I would say we have a very nice result here. Couple of things here that many times patients say, oh, are those going to be pink in the mouth? No, they're transparent or tooth colored. Let's say that I don't like the way that something looks. Well, I can come in here and I change and make changes, and I click this button here, and now I can go in using this wonderful tool that Invisalign has given us, and I can go around and I can see that I don't quite like the way this tooth looks here. So I'm going to first look and say, well, what does the contact look like? Well, the green dot means that the tooth is hitting, but when I take that away, I just don't like the way that that's there, so I need to do a movement on that tooth. That's where an orthodontic specialist is trained. Any person in the world can move teeth. You can use a tongue depressor and put enough pressure on a tooth and you can move it. But to know how, when, where, and why you move a tooth, that's what we as orthodontists are trained to do. We know the physics, we know about growth and development, and we know what our limitations are. We know that the teeth need to stay within the bone, and that's a very important thing for you as a patient to understand, that sometimes, even though you might want to not have teeth taken out, if we want to keep those teeth within the bone, within your mouth, such that you don't have gum recession down the road, maybe we have to take out teeth, and that's, in this case, what I decided to do. But let's look at this patient here. And we're going to move this teeth, and we're actually going to apply a movement called torque. We're actually going to bring that tooth down, and so we're going to take this tooth, and I'm going to come here and click it, and I'm now going to go, and I'm going to click and move this tooth down like that. And all of a sudden, look, we're going to have red marks when I show the bite coming together. See how that is there? So now, what I'm going to do, I can either use a certain feature and just take care of that, and voila, it's gone. And now once we take this off here, that looks a lot better as far as the relationship goes there. So that would be something that I'm doing as the doctor to move and get those teeth into the right position. I'm going to look here and say, do I like the way this looks here? So I use that, and I look at the lower arch. I like the way this is. Yeah, it's kind of neat to sit here and say that. So I'm going to make these minor tooth movements to get the teeth the position that I want them, and then I'm going to resubmit this to have that change done, and I'll go back and forth with the technician, sometimes 2-3 times, to get it just right for you as a patient. So in this case, I'm just going to go ahead and say reset it. So I don't want to do that quite yet. I want to go back, and we're going to take this change off, and then we're going to go back, and I'm going to show you. I want you to look and see what it looks like now with an extraction of one tooth. Got the midlines on. When we started, notice the midlines are off over here. Here's the lower midline right here. Here's the upper midline. And in the end, what we do is we get everything lined up. Now let's go look and see, such that I can show you that this treatment can be done with non-extraction according to Invisalign. Notice 49 trays was what was taken on the extraction. So we'll load this file. Same mouth. Look how many trays it takes, 64. So we're mostly concerned about this side because the way the teeth line up here, I don't like that. So we want to move these teeth back. So now I have to move this tooth, this tooth, this tooth, this tooth, this tooth, and this tooth back in the mouth. That's moving it back towards your spine. That's kind of a hard thing to do, but sometimes we might do this in certain patients. We might take out a tooth in this area to achieve that. But in this particular case, the patient wanted to have it done non-extraction. So I'm going to show her what we can do. So here we go, and notice now this tooth right now is going to start moving back. Now remember, that's knowing how, when, and why we do things. This is a hard movement to do, so we're not necessarily going to do that. And watch this. 64 trays. That's going to take 32 months to achieve what we want to. We can also wear rubber bands with aligners. That's what these tags are here, or these little hooks. And that is knowing the right time to use rubber bands and how to use them. So, bottom line, with Invisalign, I can predict and have a pretty good idea what a case is going to look like, extraction or non-extraction, before we ever get done or to the point of beginning treatment. So once I make a decision to go ahead and proceed with treatment, I like to notify the patient that, hey, I've got these aligners and I'm going to send them, have the treatment plan done, so I'm going to send it to you and let you see in your own home what it's going to look like. And so we create a movie. We come up here and we create a movie, and we go like this, and I decide what we want to do. I put my name in here. You know, I'm a male. We can't do two things at the same time. So I'll try to not talk and do things at the same time, do two things at the same time. So I go ahead and I save that file, and I have a whole bunch of different views up here that we can use. So we create a file, which I've already done, and then what I can do is I can minimize this, and I can attach this to an email, and then this is what you get as a patient. You get this, and it will show you the treatment, so you can take this and show it to your friends and family and say, what do you think? And most patients love this option that we give to them to know what their teeth are going to look like before we ever start treatment. And I would say it's probably one of the best things that we do in our office, is letting patients be involved in the final decision of how their treatment will look. So that was the treatment with extraction. And so now we'll send you this, and you get to see here everything that we see before. It's just in a movie format, and it lets you look at everything, and it works really great. So just like to thank you for giving me the opportunity to share with you how our office at Jergensen and Orthodontics does our Invisalign treatment, and why you should consider us as orthodontic specialists. We're not just people that move teeth. We're trained, we've specialized, we've been doing this for over 22 years. Thank you.